Yes, I do remember it. You can't forget something like that because couldn't drink, couldn't eat, couldn't speak, and it was mainly on my back. So I can't recall whether it really made a hindrance in rolling over and stuff like that, but it was always there. And it was something that I just wanted to get rid of altogether. It couldn't come off soon enough.
Visually, it was frightening. Her neck seemed to be hyperextended to accommodate it all. It was shockingly frightening for me to view it, and it looked very, very uncomfortable. It was noisy. And I found it frightening. I kept thinking I could only imagine how she feels, and I was glad she couldn't see it.
Well, your lips crack. Your mouth is so dry. They just want to give you like an ice chip one an hour. It's most terrible thing. I got thrush, I got cankers, a number of things all were a result of it. I'd have to say between 7 and 9 at times. 7 would be on average every day. 9 is when it just seemed to get drier in the hospital. And,
the discomfort from the dry mouth was profound for her, I think. I mean, I would have been complaining more. She did have a sore throat, but she didn't complain about it nearly as much as the furry, dry, cracking mouth.
He's had fillings, I think about 3 or 4 fillings already. And this is just, as I said, we always went to the dentist. So he didn't have any issues. And by the time we came home, he had to have quite a bit of dental work done.
How expensive has that been for you?
Very. I'd say a few $1,000s already. Just in the year that we've been home, yeah.
Back to my main routine. One of the things that I haven't been able to do is right now I'm out of work. I lost my job before I had cancer, then I had cancer, and so I was planning to get another job, but that hasn't happened. So I'm not currently covered, but I do take care to brush my teeth twice a day, floss, and they use mouthwash every now and then.
I know they can't have fluids, because when you have the tube, you can't have it, but try to do something to help the patient sort of keep the mouth moist. I know there's sprays they used to use in their mouth, and it makes them more comfortable, and having something, I could never imagine having something stuck down my throat like that, and for such a long period of time.
You would, like, I kept thinking maybe they would have a spray or something. You know how you have those aerosol misters? You can buy it in a can, like, I don't know. So I don't know if there's a commercial product or something like that, but maybe there is. Maybe that's something you should think about, and then you could incorporate that spray with. It's not going to choke them. They've got they're vented. Like, be creative. That would be my suggestion.
yes, from day one. I think it's one of the areas that has to be looked over for the overall well-being of the person.
And I realize it's not a priority. Breathing was a priority. But as far as comfort, that made her comfort and gave her comfort, and also felt she had a bit of control over a very awful situation.
So, you got your hair clean, your mouth, you felt more like a human being.
It really was a horrific experience, but without the nurses there being so good and attentive, I don't know where I would be.